Hey friends, how are you doing? Thank you so much for tuning in. I appreciate, every time tuning into this channel just for us to roll together about positive mental health. It is really important, it is vital, and I don't take it for granted, like your commitment to check into this channel. And as you know, my name is Dr. Debbie. I'm a psychiatric nurse practitioner, doctoral prepared, and licensed and board certified in the United States. And I practice in the state of New York and state of Maryland in the United States. And on this platform, yeah, it's about education, it's about mental health literacy, yeah, for us to be aware for our overall well-being and especially for our happiness and positive mental health. So today's topic, we are going to be talking about impact of self-confidence concerning our body image, and how do we see ourselves, how do we feel about our body, because especially in this in this generation that we are now, people are self-confident, people are conscious about their self-confidence, about how they carry themselves, about how they want to portray themselves, their image, in gatherings, in meetings, at the place of work, and just interacting with one another. And that is really very important, because that gives feeling of security, yeah, that's feeling of confidence and identity, as I talked about in my last video about identity. It's about who you are, it's about our self-expression, it's about our values, it's about our experiences, yeah, and all those shape who we are and how we want to be addressed. And because of this, a lot of people, because the society, especially in this age of social media and yeah, like that, many people, maybe they are being body shamed, yeah, because of their stature, because of their look, because of one thing or the other. And science, advancements in science has been able to deal with the aspect that people are able to consider, some modifications, some adjustments with medicine, with science, even as like cosmetic surgery. People are able to work on their dentition, they go see their dentist, applying braces, like glasses, eyesight, nose reconstruction, breast reconstruction, tummy tuck, liposuction, weight loss, gastric bypass, a lot of them. And different shape and both adjustment and all that, just for self-confidence, to be beautiful, to be acceptable. And with that, it's really helped a lot of people, to be secured and to feel confident about themselves. And that is why we're talking about it today, that the impact of self-image, self-beautification, body image, self-expression on our mental health. And like when people utilize cosmetic surgery, it help with positive mental health, and according to studies, that it boosts self esteem, and it's increased their self-confidence. They are not shy or ashamed of whatever deficit they've been struggling in time past. And then body image improvement, it also help with better quality of life. It reduces anxiety and over our appearance. We're not going to be concerned that, oh, because of this part of my body, that's improving the confidence. And then also it increases overall life satisfaction. People are happy about their looks, they are happy, the way they feel about their body, that they are presentable, they have good looks. And overall, mentally, as I've said, positive mental health, even the physical health, because when we are happy mentally, definitely it has a positive impact on our physical health and on our overall well-being. And the with the cosmetic surgery or all this adjustment that people are doing, especially the invasive type, that is like cosmetic surgery most of the time, like the specialists too, maybe like surgeons, maybe patients have had multiple patients that they are scheduled, for gastric bypass, weight loss, and then the specialists do collaborate with us as mental health provider, mental health clinician, to evaluate, to assess, the mental status of that person. Yeah, because one may be desperate that this is what I needed at this time, to boost my body image, my self-image, my self-esteem. But, most of the time people don't think about the post-surgery effects, because like gastric bypass, I've seen many patients coming back, after maybe having their surgery somewhere, and this is what is bringing them now because of the, like what we refer to as the complication or side effects of that weight loss. Because their body, the weight loss, there's going to be massive skin fold, all those excess fat that has been lost, the skin is going to be loose for some time, and many people are not patient enough to wait for the long time it will take for the body to adjust itself. Yeah, so they are looking forward to another surgery, to get rid of all those unpleasant sides of all those excess food, and they do call me again that, oh, this is what I actually need, I'm planning to go for this cosmetic surgery. So it is important. Yeah, the essence of bringing the discussion is that it's not something that one will rush into, that you need to collaborate with us as per mental health, and then you see the impact of mental health. It covers actually every aspect of life. Yeah, even some legitimate desire that we may have, you may not be thinking about the after effects, about what follows after, but we see that, and we are conversant with such, so we are able to deal with that with you, walk you through it, and prepare your mind for what is going to be, comfort after that, so that you are in a good spot, you are not getting any surprise, you are well prepared, and that is not going to stress you, that is not going to overwhelm, your mental health. So and as I said, in the process of that, like maybe if it is a client that has been like clinical mental health concerns, then the assessment goes deeper, because one thing is that, yeah, like clinical mental disorders like depression, mood disorder, and every kind of diagnosis under mental health, cosmetic surgery, body image enhancement is not able to deal with that. It's able to give you a new look, a new image, a new body image, but the clinical aspect of the mental health concerns like depression, that is typical, that is atypical, that is about your internal, mindset or state, mental health status, is not able to be resolved or treated, with cosmetic surgery. You still need to treat that, get treatment from your mental health clinician. So because that may not really be safe, going for treatment with cosmetic surgery, even with an underlying mental health concern, that is not able to resolve it, as I've said. And the stress, and all that it entails with cosmetic surgery may even exaggerated it. So any mental health concern, that is deep rooted, yeah, because of aftermath of cosmetic surgery, yeah, so it is important that you get treatment, yeah, from your mental health clinician. And also, as I've said, it will help you with your appearance, but like conditions, like past trauma, if you have gone through trauma, like post yeah, traumatic stress disorder, like depression, eating disorder, anxiety, serious mood disorder, cosmetic surgery is not able, to treat that. So it would be helpful that you see a mental health clinician that we treat that, and then when you are stable, then they will be able to give the recommendation when you are ready for the body image enhancements, adjustments, and surgery. And according to studies, with body image enhancement, adjustment, beautification, all those, it's help to raise, self-esteem, as I've said, and confidence, and it's improve, satisfaction overall, which also enhance, our happiness, and of course our quality of life, because with that we are able to, be outgoing, interact more, meet people, have that self-confidence. So there will be positive interaction and positive mental health. I hope you learned something, and it is what I brought across our way today, that mental health is not only for people that have severe mental health concern, even it covers every area of life. Yeah, you want to be acceptable, you want, self-love, self-esteem, confidence, everything still um, boils down to positive mental health. And that is why I am here for you, your mental clinician, to bring all this, to our attention, about education and literacy, about how important our positive mental health is. And I hope you learned something. Check my bio, yeah, to connect, to learn more, and share this video that many people too will come to the knowledge of this mental health education, this mental health literacy, so that we can all be happy together and do well, and have a better quality of life. All right, it's me, your mental clinician, Dr. Debbie. Be safe and have a good one. Bye.